Now, what is the fracture and what are the causes of fracture? Fracture is breaking in the bone. Now, the most common cause of a fracture is a trauma. And you know that we may involve in many trauma during our life. Road traffic accidents, home trauma, sport injuries, as you can see in the slide. All these activities may cause fracture. Now, what are the clinical signs of fracture? First, we start by symptoms. Definitely, the patient with a fracture is complaining of pain. He will come to you telling you that I got trauma and I have pain at certain part of the body at the site of the fracture. Other symptom of fracture is loss of function. The patient cannot use his limb, his hand, he cannot walk on his leg if there is a fracture in the lower limb. Other symptom is a swelling at the site of the fracture. And always when you want to examine for a fracture, you have to compare between right and left side to see the differences in at the site of the fracture. So swelling, if it was very minimal, you can see it when you look at the normal side. Deformity, if there is displacement of the fracture, there will be deformity also. And on examination, يعني هذه احنا symptoms هو pain و loss of function و swelling. Deformity ممكن احنا نشوفها تصير sign, and the patient may tell you that I have deformity, which will be a symptom. احنا متفقين انه deformity symptom و sign at the same time. So by examination, by looking, there is swelling, and if there is deformity, there will be deformity at the site of the fracture. By feeling, there is bony tenderness. When you put your hand on the affected side, there is tenderness, and you can see, look at the face of the patient to see if there is any tenderness or not. Crepitus, اللي هي مثل القرقعة at the site of the fracture. You can feel it, and sometimes you will have abnormal movement at the site of the fracture, apart from the joint. So these are more important symptoms and signs of fracture. Next slide. Now, how you describe fracture? ممكن يكون description anatomical according to the location of the fracture at the metaphysis, at the diaphysis, يعني metaphysis أو epiphyseal part at the end of the bone or the shaft of the bone نسميه diaphysis. You describe the type of the fracture, the parts of the fracture, ممكن يكون more than one part, and whether the fracture is intra-articular or not, يعني it passes through the joint or it is outside the joint. Displacement of the fracture, almost always we describe the displacement according to the distal fragment. So we say that the distal fragment displaces posteriorly or anteriorly or lateralward or medialward or whatever. So you describe the displacement of the distal fragment in relation to the main bone, main bone. The types of displacement are either angulation, so there is angulation or malalignment of the fracture, especially for long bones. Axial, يعني معناها صاير overlap, fracture with overlap, or rotational displacement, which need good reduction. Next slide. Description of fracture, also what's the mechanism which causes the fracture, the fracture pattern, the energy which causes the fracture. We have low energy, medium energy, and high energy. يعني low energy, for example, fall during walking. واحد زحلق بالمطبخ ووقع انكسر نسميها low energy. الهاي انرجي هي مثلا ال RTA يعني road traffic accident, war injuries due to bullet explosions. Fall from height ممكن تكون medium energy because each energy may cause a certain type of fracture. Also, you should look for the soft tissue envelope which surround the bone, whether it is injured or not. So if there is injury to the soft tissue with the fracture, we call it open fracture. This is very important. And you should describe the maturity of the skeleton of the patient, يعني whether the patient is skeletally mature, يعني adult, or skeletally immature, يعني معناها child. This is very important because sometimes we look at the epiphyseal lines and we may miss it as a fracture. In the children, we have the epiphyseal plates, which looks like a fracture, but في الحقيقة it is not a fracture. So that's why you have to describe the maturity of the skeleton, whether the patient is skeletally mature, يعني adult, or skeletally immature, يعني child. We have another type of fracture, which we call it the pathological fracture. And pathological fracture occur in a bone with a pathology, certain type of pathology. It is not a normal bone. There is a disease in this bone where we will have a fracture. We call it pathological fracture. ممكن يكون هذا الديزيز infection of the bone, ممكن يكون tumor of the bone, ممكن يكون cyst of the bone. Anyhow, so when we will have a fracture through this site where there is a disease or a disorder, like I said, bone cyst or bone tumor or bone infection, we call the fracture pathological fracture. It may be part of a local pathology or systemic pathology. Next slide.
دكتور شيء معناته الهاي انرجي قلت؟
هاي انرجي يعني إصابة نتيجة يعني الشدة سريعة مثل رود ترافيك اكسيدنت بعض، يعني حوادث السير، أو وور انجريز يعني حوادث الحروب، البوليت اكسبلوجنز يعني انفجارات، فتجي شظايا وفراغمنتس متطايرة بسرعة سريعة كلش، and it causes fracture. هاي نسميها هاي انرجي. حوادث الطائرات مثلا أيضا هاي انرجي. اوكي.
عفوا دكتور، pathological fracture شنو يعني local and systemic؟
يعني ممكن أنت عندك systematic disease مثلا osteoporosis, generalized osteoporosis in the body, especially in old people. This generalized osteoporosis which causes weakness of the bone. راح أعطيكم عن المحاضرة يمكن الأخيرة إن شاء الله مع aging, and we will talk about osteoporosis. And there are certain fractures which may occur in people with osteoporosis. مثلا fracture lower radius, fracture neck of hip, neck of femur, fracture vertebra. فممكن تكون هي generalized pathology and you got a fracture, or the pathology is localized. مثل أكو bone cyst in one site, in one bone, ويصير through this cyst يصير fracture. أو أكو tumor بالبون ويصير through it يعني weak bone يصير fracture. أو infection of the bone ويصير fracture at the site. So this is either localized or generalized يعني disease. مفهوم يعني؟ Okay. This slide show you the fracture healing.
تعرف دكتور بس عفوا لكم
بلي.
دكتور، طلاب رابط الحضور نزل بيه تسجلوا بيه. تمام دكتور براحتكم.
Okay. ماشي. سجلوا الحضور. For fracture healing we have 3 phases of healing. The inflammatory phase which occurred between the day 1 to 5 days. There is inflammatory reaction at the site of the fracture. And then we have the reparative phase of healing, takes about 4 to 40 days. And then we have the remodeling. If there is any deformity, the body will act to make the fracture in a correct position, نسميها remodeling. which take about 25 to 20 days to occur. And at the end of the healing, we will have what you call it callus formation. So callus around the fracture site is a sign of healing of the fracture, callus. Next slide. Now, what affects the healing of the fracture? Factors influencing bone healing. We have local factors, we have regional, systemic. Local factors for healing, يعني ممكن يصير عندنا delay بالhealing أو يصير عندنا normal healing. Now, in case of injury, fracture configuration, soft tissue injury. So, if you have an open fracture and contaminated fracture, there will be delay in the healing. Okay. The type of the bone which is fractured. يعني what do we mean by this? If the fracture was at a cancellous bone or a cortical bone. Cancellous bone هو يصير at the end of the bones بالميتافيسيس, والcortical bone هو يصير بالdiaphysis يعني بالshaft. The healing in the cancellous bone will be faster than the healing in the cortical bone. Why? Because in the cancellous bone there is high vascularity, and high vascularity means good and fast healing. Okay, so the fracture at the end of the bones heals better than fracture at the shaft of the bone. Another factor, local factor, who is the type of treatment, type of reduction, if you reduce it well or correctly, and if the fracture is stable, يعني you are holding the fracture good in good position, and if there is any infection at the site of the fracture, it will delay the healing. Regional factors like blood supply, muscle cover. We say that if there is a good blood supply, there will be good healing. Also, if there is soft tissue coverage للbone in case of open fracture, a good muscle cover will enhance good healing, while exposed bone will not heal correctly and properly. Systematic factors which influence bone healing, like the age, because you know the children, young infants, they have fast healing. When the patient become older, there will be slow healing. Comorbidity and presence of other diseases like diabetes, like hypertension, heart diseases or others, especially diabetes, will affect the healing. Another factor is smoking. وثابت من الدراسات أنه smoking will cause delay in healing of bone. Also, if there is any bone pathology, any disease, any infection at the site of the fracture, and in case of head injury, there will be delay in healing of the fracture. We do not know why. In head injury, there will be delay in. Okay, next slide. Next slide, هذا يراويني في الجدول. Okay, this is a table which will give me the approximate يعني date for healing. في الحقيقة هو هذا مو شيء ثابت, because now each fracture, each site, we will have different types of يعني time of healing. بس هذا هيك roughly, يعني مثلا بالupper limb, children, it takes 3 weeks to heal. The adult, it takes double the time, 6 weeks. While in the lower limb, it takes the double time for healing, and the children in 6 weeks, and in the adult 12 weeks. قلنا هاي الأرقام مو ثابتة وأكو بها اختلافات, بس this is يعني a rough table for time of healing. نشوف أنه الأطفال دائما الهيلينج يصير لهم أسرع من الأدلتس. Next slide. When healing goes wrong, malunion, يعني معناها there is healing. Malunion معناها there is healing of the fracture, but there will be deformity. Healing with deformity. There is healing, there is union, but with deformity. Or there will be degenerative changes of the nearby joint, which is a late arthrosis or osteoarthritis or osteoarthrosis. Sometimes we'll have non-union, and there will be no union at all. Now we have two types of non-union: hypertrophic, where there is non-union but there is callus at the site of the fracture, and the other type was atrophic non-union, where there is no callus and there is no union. So hypertrophic non-union with callus, atrophic there is no union and there is no callus. Also, if we have infection at the site of the fracture, the healing will go wrong. There will be delay in the healing, and sometimes we will have non-union unless you treat the infection. Next slide. Complications of a fracture. هذا التيبل نمشي عليه على السريع. عندنا early complications and late complications. For early complications we have local and systemic. Local هو nerve injury, for example fracture of shaft of a humerus and injury to the radial nerve. The patient will have wrist drop. So nerve injury, but might be injured at any fracture. Vascular injury is very important. Any big vessel may be injured with the fracture, and this needs urgent treatment. Compartment syndrome, which is increased pressure inside the compartment, which causes embarrassment to the vascularity of the limb, should be treated urgently by decompression of the compartment, the muscular compartment, I mean. Avascular necrosis, which means death of the part of the bone, for example, fracture neck of femur. We may have, after 2 to 3 months, avascular necrosis, death of the head of the femur, infection at the site of the fracture, and surgical complications if you do surgery like internal fixation of the fracture. Systemic complications, early systemic complications, hypovolemia due to bleeding, accompanying the fracture, and if it is not treated, it will lead to hypovolemic shock, and the patient may lose his life. So it is very important to look for bleeding with the fracture. Fat embolism, fatty droplets from the bone which go to the circulation and reach the lung and causes fat embolism. It is big. If it was big, it may lead to death of the patient. Pulmonary edema, deep venous thrombosis, another complication. Acute respiratory distress syndrome, اللي هي ARDS, acute respiratory distress syndrome, is another complication. And lastly, we have disseminated intravascular coagulation. DIC هي disseminated intravascular coagulation. احنا ذني complication نمشي عليها على السريع، ناخذها بعدين بالتفصيل بصف رابع بالorthopedic module or orthopedic block, but you have to know something about it. Next slide to show you the late complications of fracture. Late complications. Again, we have local and regional. And the local complication هو delay union. يعني احنا ما راح يصير union بالمدة اللي نعرفها. المفروض انه مثلا يصير union 6 weeks ويمضي على المريض مثلا double the time 12 weeks and there is no union. نسميها delay union. Non-union, there will be no union at all. لا بالمدة المفترضة ولا بضعف المدة ولا في أي مدة أخرى. There will be non-union at all. There is no union. Malunion means union with deformity. There is union, but there is deformity at the same time because you didn't reduce the fracture or there is redisplacement of the fracture. So it will end with union with deformity. Myositis ossificance is ossification or calcification in the muscles near the joint, near a fracture. For example, a supracondylar fracture of a humerus in children may end with myositis ossificans and the stiffness of the joint, the elbow joint. Refracture, when you remove the cast early, there will be a refracture at the site of the fracture. For regional late complications, we have osteoporosis, which may be localized to a limb, and if the patient is bedridden, there will be generalized osteoporosis of disuse atrophy of the part of the body or the whole body. Important complication of fracture is joint stiffness, which is the most common complication following a fracture. Stiffness of the joint, it means the patient cannot move his joint properly in the normal range. This is the most common complication following a fracture, and it is treated by early mobilization and exercises of the joints. Early mobilization and exercises of the joints during the fracture and during the treatment of the fracture. CRPS here, a chronic regional pain syndrome, where the patient after trauma to the upper limb or lower limb will continue to have, after healing of the fracture, continue to have pain at the foot or at the hand. It is thought that it may be due to sympathetic affection of the vessels of the limb. Abnormal biomechanics, which may occur due to improper reduction of the fracture. And lastly, a late fracture complication is osteoarthrosis or osteoarthritis, which means degenerative changes of the joint, especially in case of intra-articular fracture, which is not reduced properly. Intra-articular fracture, which is not reduced properly, will lead to osteoarthritis. هاي ممكن تظهر وراء 4 سنين 5 سنين من الفراكشر. Osteoarthritis or osteoarthrosis, which means degenerative changes of the joint. Next slide, compartment syndromes, which is very urgent condition. It is raised pressure within an enclosed facial space leading to localized tissue ischemia. يعني شو بمعنى أنه يصير عنده fracture and there will be increasing edema or bleeding inside a muscular compartment, and this increasing pressure inside the compartment, it will lead to pressure on the veins and then on the arteries, and there will be a closure of these vessels, and there will be ischemia if the condition is not treated. What are the clinical signs of compartment syndrome? There is pain at the site of the fracture, excessive pain, progressive, which is not relieved by analgesia. And there will be pain on passive stretching of the muscles at the site of the fracture. There might be neurovascular changes, and in case of doubt, if you are in doubt of this case, you have to do something to reduce the pressure inside the compartment by what we call it surgical decompression. راح نفتح السكين with fascia in order to decompress the compartment and to decrease the pressure on the vessels at the limb. It is a saving أو يعني to save the part of the body, upper limb or lower limb. نسميها decompression. Next slide. What is open fracture? Open fracture is fracture with communication to the exterior. يعني ببساطة open fracture is a fracture and the fracture site or the fracture hematoma is communicated to the exterior. يعني أكو اتصال ما بين الخارج والfracture site. There is a classification for open fracture اسمها Gastello-Anderson classification, Gastello-Anderson. We have 3 grades of open fracture, or 3 types, the type 1 or type 2 or type 3. Type 1, which may occur due to low energy, and the size of the wound is less than 1 or 2 centimeter. حقيقة less than 1 centimeter, يعني small wound with soft tissue, نسميه type 1. Type 2 ممكن أيضا low energy or medium energy, and the soft tissue injury is less than 10 centimeter. The soft tissue injury is less than 10 centimeter. Type 3, when the soft tissue injury is more than 10 centimeter. إذا ببساطة التايب 1 هي less than 2 cm, التايب 2 هي less than 10 cm, and type 3 is more than 10 cm, which may occur due to high energy trauma مثل ما قلنا RTA war injuries. There is multifragmentary يعني comminuted fracture نسميه, and there will be extensive soft tissue damage مثل ما نشوف بالصورة هاي اليومكم.
دكتور يعني اندرسون
هم أشخاص ذولا جاستيلو and أندرسون أشخاص يسوون كلاسيفيكيشن فتسمى الكلاسيفيكيشن باسمهم. يعني ممكن أنت تقول محمد كلاسيفيكيشن، حسين كلاسيفيكيشن، هذه جاستيلو and أندرسون. أوكي؟ راح تسمع أنت هواية أسماء أشخاص هم يعني they describe something, they put classification somewhere. أوكي؟ يعني هسه مثلا كوليز فراكتشر راح ناخذه بعد شوية، هو فراكتشر وصفه شخص أو طبيب اسمه كوليز. أوكي next slide. Fracture in children, as you know, we have epiphyseal line at the end of the bones. So there might be fracture through this epiphyseal plate or epiphyseal line. وهذا epiphyseal growth plate نسميه. So we might have incomplete fracture اللي نسميها احنا green stick fracture أيضا. نشوف هنا buccal أو torus fracture compression أو green stick fracture اللي هي due to tension. green stick بالضبط هي مثل كسر العظم كسر العود الأخضر. Now when you break the green stick, يعني the shaft will be continuous. There will be no displacement or very minimum displacement. هسه انت اذا تاخذ عود اخضر وتكسره شوف بالبيت ما راح ينفصل، مو مثل العود اليابس. So this is a common fracture in children. بالحقيقة the most common fracture in children هو green stick fracture. And you might have fracture through the epiphyseal growth plate مثل ما بنشوف بهاي الصورة مع lower radius. Epiphyseal plate displaced posteriorly. In children there will be rapid healing. يعني كل ما يكون الchild younger the healing will be faster. يعني الطفل اللي عمره شهر بعد أحسن من الطفل اللي عمره سنتين مثلا. وقلنا growth plate epiphyseal fracture هذه بيها فد classification أيضا. شوف النكست سلايد. هذه هي الكلاسيفيكيشن مال epiphyseal fractures يسموها سالتر and هاريس. سالتر هاريس classification. أيضا دولة شنو سالتر وهاريس؟ دولة أشخاص أطباء وصفوا fracture through the epiphyseal plate سموها سالتر هاريس. فنشوف بالصورة هنا تايب 1 الصورة الأعلى على اليسار، والتايب 2 العفو الأعلى على اليمين. اللي يميز التايب 2 هو أكو triangular fragments from the metaphysis which may be displaced with the epiphysis. Type 2 is the most common type of Salter-Harris fracture. Type 2 is the most common type. نشوف الصور الوسطانية هي type 3 و 4. The fracture is through the articular surface through the epiphysis. واضح. And type 5 and 6 هي fracture through يعني contusion الحقيقة contusion of the epiphyseal plate. Contusion of the epiphyseal plate which sometimes it is not very يعني clear in the X-ray. It is not very clear in the X-ray. Sometimes we need an MRI to see the type 5 and 6 Salter-Harris fracture. Okay. Next slide. Now what is stress fracture? هسه احنا عندنا fracture due to trauma or a normal bone, which is the most common type of fracture. سمعنا عن شيء اسمه pathological fracture, which is a fracture of a diseased bone, fracture of abnormal bone. Now stress fracture, what is stress fracture? It is fracture through a normal bone, but it is due to repetitive type of trauma, repetitive non-violent stresses. repetitive. Okay. Sometimes they said it is due to fatigue of the bone, fatigue or insufficiency. It may occur in the spine, in the tibia, in the femur, pelvis, foot. Now, the most common example for stress fracture is a fracture of the second metatarsal, يعني بالفوت. نشوفه بهاي الصورة. Fracture of the second metatarsal واللي هو إلى اسمه مارش fracture. مارش fracture. M-A-R-S-H. مارش fracture يعني مارش fracture معناها fracture لأشخاص they walk for a long distance. هذا شخص ما متعلم يمشي مسافات بعيدة أو يهرول أو يسيم يعني بالاستعراضات مثلا. Then he will start complaining of pain in the foot with swelling, وبعد أسبوعين من نسوي له X-ray نلقى there is a callus. يعني sometimes we will not see the stress fracture in the acute stage. Pain, swelling, after walking or running for a distance. بعدين ورا أسبوعين نسوي له X-ray نلقى callus at the second metatarsal. اسمه marsh fracture, which is the most common example for stress fracture. Repetitive type of trauma causes stress fracture. What are the predisposing factors? Females more than male. The predisposing factors are osteoporosis, sports, eating disorders. يعني ممكن يكون insufficiency of malnutrition. ممكن نظريات بس مو ثابتة. Okay, next slide. قبل شوية كنا نحكي عن osteoporosis. زميلكم سألني يقول شنو يعني pathological fracture. Osteoporosis. What is osteoporosis? It is reduce in the density of the bone. Decrease in the density of the bone. كثافة العظم. Decrease in the density of the bone. Or it could be generalized, especially in old people. You have two types of osteoporosis generalized. You have the postmenopausal. ناخذها بالمحاضرة الأخيرة. يعني in female above 50, and senile osteoporosis in people above 65. Characterized by low bone mineral content, يعني calcium, which enhance bone fragility and consequent increase in fracture risk. Okay. The most common fractures due to osteoporosis هي fracture lower radius مثل ما تشوفون بهذه الصورة اللي موجودة. Fracture lower radius نسميها Colles fracture. Other example هو fracture neck of femur. The third example هو fracture of spine, especially at the lower thoracic spines and upper lumbar spines. Okay, sensitivity to estrogen. يعني sometimes we need to give the patient estrogen. Weight bearing exercises. The common sites قلنا هي wrist to hip و spine of this fracture osteoporosis. Okay, next slide. Fracture management. How do you treat a fracture? عندنا ال ABCDE اللي هي airway, breathing, circulation. هذه يعني هي رادة محاضرة واحدة تاخذوها أنتم إن شاء الله بصف رابع وبصف سادس. يعني you should treat the patient as a whole. يعني مو بس أجي على fracture. If he got an accident, you look at what is important, what is killing the patient. ممكن المريض يكون عنده head injury, chest injury, abdominal injury, ويا fracture. So, what is the most important injury? طبعا هو head injury, neck injury, chest injury. Then you may treat the fracture lately. So you treat the patient as a whole if he has multiple injuries by the ATLS, Advanced Trauma Life Support هذا ecosystem. We start by airway, breathing, circulation, neurovascular assessment, يعني if there's any nerve injury, vascular injury. Priority to soft tissue, if there is gross decontamination, in case of open fracture طبعا. Soft tissue coverage, you should give the patient antibiotic, anti-tetanus. نعم. أحد عنده سؤال؟ Okay. If there's any fractures with this patient with multiple injuries, you have to splint the fracture and transfer the patient to the nearby hospital. Look, feel, move, these are, you know, the examination for fracture, X-ray in two plans. Assess the joint above and the joint below the fracture. يعني الإكس-راي لازم تاخذ لي الjoint above and joint below. Next slide. So, what are the questions about the fracture? What is the fracture? Where is the fracture? Is it open or not؟ لأنه open يختلف، راح نحتاج قلنا antibiotic و anti-tetanus وممكن debridement. Is there a neurovascular compromise? يعني any injury to the nerves or the vessels? Now, the injury to the nerve is not urgently treated, but the injury to a main vessel, it needs urgent treatment. يعني معروفة ليش إنه هو urgent treatment for vascular injury. النيرف إذا صار به nerve injury ممكن إحنا نعالجه في وقت آخر. And also if there is any other injuries, يعني the fracture, wear injuries, اكو head injury, chest injury, abdominal injury. Now, if there is nothing about other injuries, there is no neurovascular compromise, you have time to treat the fracture. اللي هي يعني على كيفنا راح نشوف احنا شو نسوي. يعني isolated fracture شو راح اعالجه؟ مفهوم؟ يعني مو multiple injuries، واحد عنده fracture lower radius or fracture بالفيمر. The first question is this fracture is displaced or not? يعني does it require reduction? Because if it is displaced and it needs reduction, you have to reduce it. احنا عندنا the steps of treating a fracture. First of all is to reduce، يعني ارجع الفراكشر الى وضعه الطبيعي، reduction. The second step is to hold or immobilize، يعني immobilize the fracture. And the third step is exercise. Then, if the fracture is displaced, we have to reduce it. How you are going to reduce it? And how you are going to immobilize it? Okay. So, احنا عندنا many types of reduction. Closed reduction, reduction by traction, and sometimes we need open reduction, يعني surgery. Then you need to, after reduction, you need to immobilize the fracture or to hold the fracture. And how you are going to hold it? Again, ممكن traction, skin traction, skeletal traction, by plaster of Paris، يعني cast، يعني جبسونة، أو هالأيام عندنا fiber glass بمكان plaster of Paris. ممكن نحتاج external fixation, especially in open fractures. أو ممكن نحتاج open reduction and internal fixation. ORIF يعني open reduction plus internal fixation. How we are going to do internal fixation? Plate and screw, intramedullary nail, other types of fixation. And then you start exercising the joints directly after the holding the fracture in order to prevent stiffness. Then, if the patient needs admission, or you may treat him as an outpatient, you give him pain relief, potential complications لازم نتوقعها to treat it. احنا أخذنا complications. And if the patient needs sick leave or whatever, social management. Okay. Next slide. Next slide هاي treatment of fractures. هسه حكيتها أنا. دائما examine for vascular injury. لا اللي قبلها قبلها سلايد دكتور. أنا هذا ضايف سلايد، هو هذا نفس الحكي أنا ضايفه. Examine for vascular injury directly and treat it urgently. Reduction, immobilization and exercise. Non-operative treatment هاي بالصورة اللي انتو دا تطلع عندكم. We use splintage. دكتور هذا conservative treatment of a fracture اللي هي RICE، مو طالع عندك هنا. ال RICE هي ال R for reduction، ال R for rest، العفو اكتب يمك R for rest، ال I for ice يعني ice bag، يعني first of all you have to rest the injured part. Second you put ice pack يعني كيس ثلج at the site of the fracture or at the site of the dislocation to decrease the edema and to decrease pain. C هي compression، يعني we use compression bandage اللي احنا هسه نسميه crepe bandage أيضا to decrease the edema. والE هي elevation. Okay. So R for rest، I for ice pack، C for compression bandage، و E for elevation. واضح يعني؟
دكتور والبي؟
لا هي هاي البي يعني انتم حتى ما تتذكروها برايس، الحقيقة هي RICE. مرات يضيفوا لها A RICE. الاي هي anti inflammatory drugs which for pain and for edema. For pain and for edema. Okay. Next slide. Next slide. Next slide please. أسرع وين صرتي؟
العفو دكتور، بس على الأوبراتيف تريتمنت بل قبل لأنه
هسه أنا هذا حكيته. بلاستر انستراكشن هذا هو يعني البي او بي كاست يعني التجبيس. هذا أنا هذا حكيته أقروها أنتم كلش واضحة عندكم، وإن شاء الله من تجون للاستشارية أو للمستشفى ونشوفها هذه. أنا عندي يمكن أدزكم في المحاضرة شوية بيها سلايدات إضافية كصور. هسه من نخلص أدزلكم إياها على التليجرام إذا حبيتوا، نفس المحاضرة بس بيها شوية سلايدات. أوكي. Operative treatment سنتين طلعت لنا. Protect soft tissue طبعا. You have to be gentle with the soft tissue. Avoid infection. Sometimes we do closed reduction or open reduction under the screen. نستخدم الإكس-راي. For immobilization we use implants يعني مثلا plate and screw. We may use intramedullary nail. But it should be biologically inert يعني ما تتفاعل ويا الجسم، ما يصير بها صدى وتفاعلات. فهي معاملة بطريقة to be biologically inert. You need anatomical reduction especially in case of intra-articular fracture. يعني intra-articular fracture should be reduced as perfect as possible, while other fractures at the shaft away from the joint يعني it's not very important to have very anatomical reduction. ليش الانترارتيكولار؟ حتى لا يصير configuration بالarticular surface which will end in future with the degenerative changes يعني osteoarthritis. Interfragmentary compression نسوي by plate and screw. Stable fixation is important. And early joint rehabilitation and muscle rehabilitation يعني movement of the muscle و strengthening of the muscles, movement of the joint and strengthening of the muscles. High rehabilitation اللي هي movement and exercises. Next slide. Next slide. Surgical options ده تشوفون هنا الصورة اللي فوق على اليمين هذا external fixator device. الصورة اللي أعلى على اليسار هذا traction skeletal traction يعني immobilization by traction. الصورة اللي بالأسفل اللي على اليمين مثلا أسفل يمين هذا intramedullary nail شيش في داخل العظم. الصورة الوسطانية هي plate and screw، صفيحة وبراغي. والصورة اللي الأسفل اليسار هي fixation by screw only، يعني برغي واحد يكون كافي. The different types of fixations، surgical options أو non-surgical. هذا الأعلى على اليسار هو skin traction، skin traction أو skeletal traction بالحقيقة، هذا non-surgical. أوكي، شو المحاضرة صارت طويلة ما أعرف. هسه احنا راح نعطي examples of some common fractures. التفاصيل أنا ما راح أنطيها بس هيك على السريع. تشوفون هذا clavicular fracture وعلى طول كل سنة يجيكم سؤال عليه. The clavicular fracture is a common fracture in any age occur due to fall or sport injury. The most common site هو middle third. نشوف هنا بالصورة middle third fracture، ونشوف البروكسيمال فراجمنت اللي هي من جهة الميد يعني medially نشوفها displaced upward while the distal fragment displaced downward. وهذا دائما يجيكم سؤال بالامتحان، ليش البروكسيمال fragment رايحة upward؟ It is by the action of the cleidomastoid muscle، سحبتها للأعلى. هذا distal fragment displaced downward by the weight of the limb، يعني وزن الجسم الجرافيتي منزلها لأسفل، فصاير هذا type of displacement which is a common type of displacement. هسه افتهمنا ليش؟ cleidomastoid أخذت لي البروكسيمال fragment upward، والweight of the body أخذ لي distal fragment downward يعني الأوتر part. treated by a sling for عيني.
تقدر تعيدها دكتور؟
أعيدها؟
دكتور شنو قصده بسلانج 352؟
سلينج يعني تحط ايده بسلينج، تعلق ايده بهاي حمالة الذراع for 3 weeks، 3 من 52 اسبوع اللي هي عدد اسابيع السنة. هاي حتى ببقية السلايدات خوش سؤال. 3 اسابيع سلينج. mobilize as able، slow to put most heel deformity. طبعا هالايام for displaced fracture سابقا كنا نعالجه conservatively، هسه هنا باوروبا وبكل مكان for this fracture with displacement التريتمنت هو open reduction and internal fixation by either plate and screw or nail، intramedullary nail. Displaced fracture of the clavicle is treated surgically by reduction، open reduction يعني نرجعه ونثبته plate and screw or intramedullary nail. يلا next slide. fracture of proximal humeral أو neck of humerus تشوفوه هنا أيضا due to fall occur in old people، نسميها surgical neck يعني below the anatomical neck. We have 3 types of this fracture، either 2, 3 or 4 parts. اللي هي 4 parts شنو؟ shaft of the humerus، head of humerus، greater tuberosity and lesser tuberosity. فهذا الفراكشر بالgreater tuberosity وليسر وهيد وشافت يعني 4 خطأ سميه type 4. إذا only 3 وإذا only fracture through the neck يعني the head والشافت سميناه type 2. إذا minimally displaced نخليه له يعني collar وسلينج، وإذا كان displaced ممكن نسوي له open reduction internal fixation أو external fixator. And sometimes we do what we call it hemiarthroplasty، يعني we excise the proximal part of the humerus and we put prosthesis. هذا in type 4، هذا 4 fragments. تمام. next slide على السريع نمشي عليها. هذا fracture of distal radius in children, which is the most common fracture in upper limb in children. This is the most common fracture in upper limb in children. إنه ممكن يكون green stick fracture through the metaphysis، أو ممكن يكون fracture through the epiphyseal plate chapter Harris 2، إنه the most common. Okay. إذا كان undisplaced POP cast 3 أسابيع، وإذا كان displaced نسوي له manipulation under anesthesia يعني reduction we put POP cast. Sometimes we may have to put K-wire يعني internal fixation. The POP may last for 5 weeks 5 من 52 يعني 5 أسابيع. Next. راح أدز لكم المحاضرة شوية المحدثة إن شاء الله على التليجرام بالنهاية. Distal radial fracture. This is a common fracture in adults, especially in post-menopausal women due to osteoporosis. قبل شوية حكيناها. This is one of the most common fractures in osteoporotic women. The women after 50. إذن osteoporosis الكوليز هو يكون ال distal fragment displaced dorsally, while if the distal fragment displaced anteriorly سميناها Smith fracture. Treatment إذا minimally displaced POP cast for 4 to 5 weeks, and if it is displaced نسوي لها manipulation. Sometimes we need to put K-wire, and sometimes we need to do open reduction internal fixation or RIF, or another option is external fixation according to the type of the fracture and according to stability. Next. Fracture neck or femur or hip fracture يسمون. We have two types of of hip fracture. Intracapsular يعني within the capsule of the hip, هذا نسميه intracapsular. Due to fall occur most commonly in elderly people due again to osteoporosis. There is high risk of avascular necrosis. هذا AVN يعني avascular necrosis. أنا قبل شوي قلنا واحد من complications of a fracture هو avascular necrosis, death of the part of the bone. هنا راح يصير death of the head of the femur. هذا example of avascular necrosis. Treatment according to the type of the displacement ممكن يكون internal fixation, وممكن sometimes we need to do hemiarthroplasty. يعني you excise the head and you put prosthesis. Next slide. هذا another type of hip fracture. It is extracapsular يعني the fracture site is outside the capsule of the hip. وهذا احنا نسميه sometimes trochanteric fracture. يعني ممكن يكون الفراكشر لاين بين الجريتر تروكانتر والليسر مثلا مثل ما نشوف بهاي الصورة. Again it is due to occur mostly due to fall يعني low energy trauma. Elderly people are mostly affected due to osteoporosis. There is low risk of avascular necrosis, not like the intracapsular high risk. If it is undisplaced ممكن نسوي له close reduction and internal fixation by screws, أو هسه الأيام نستخدم gamma nail أو dynamic hip screw. Okay. Internal fixation. Next slide. Fracture shaft of femur. أحدث لكم إياها. وهاي fracture shaft of tibia طالع لكم بالصورة. ممكن يكون due to fall, ممكن يكون to RTA or sport injury. Mid shaft or distal shaft may be fractured. Sometimes it is open fracture, especially in high energy RTA or injuries. Be aware of a compartment syndrome which should be treated urgently. If it is undisplaced, plaster or Paris يكفي for a few months, ممكن 3 to 4 months. And if it is displaced, you may use external fixation in case of open fracture, intramedullary nailing, or plate and screw. Next slide. Ankle fracture, as you can see, ankle fracture, fracture of lower end of tibia and fibula. إلى اسم نسميها Potts fracture, POTTS fracture, Potts fracture, malleolar fracture أو ankle fracture. Again due to fall or sport. ممكن يكون one malleolus fracture يعني unimalleolar or bimalleolar. Distal tibia and fibula syndesmosis, it could be stable or unstable according to the line of the fracture. If it is below the syndosmosis اللي هي يعني the lower tibiofibular ligament, if it is below it نسميها stable. If it is above it نسميها unstable. In case of a stable fracture, brace or POP cast for about 3 weeks. Sometimes it is more than 3 weeks. And in case of unstable fracture, we do open reduction and internal fixation. Okay, this is the end of this long journey, long lecture. If you have any question, راح أدزلكم على محمد صلاح، أدزلكم المحاضرة شوية المحدثة اللي بيها شوية سلايدات إضافية شباب، بيها سلايدات إضافية.
دكتور
تفضل
دكتور، هاي الديسبليزمنت أو ديسبليزد هواي دكتور بها أرقام وبها طرق، هم داخلة يعني نحفظهن يعني
هو شوف نعم
يعني قصدي دكتور mainly displaced وديسبليزد هواي بها يعني هذني آخر 10 سلايدات هم نحفظهن هذني الأرقام.
هذا هو شوف undisplaced يعني the fracture needs non-reduction and sometimes the fracture if it is not displaced راح نعالجه mostly conservative يعني by POP cast يعني نجبسه تجبيس مثلا. In case of displacement you try reduction and if you fail to reduce the fracture we do what we call it open reduction. راح نروح ندخل المريض عملية ونفتح البون you reduce the fracture and when you reduce the fracture by open method you do internal fixation. راح تستخدم plate and screw intramedullary nail or any other يعني device accordingly. اوكي
دكتور قصدي داخله يعني بالامتحان
يعني شنو داخله بالامتحان؟
يعني قصدي نحفظهم دكتور لا
التفاصيل لا انا بس بالنسبه لي الاشياء العموميه اوكي يعني مبارك من تقول لي اذا اسالك اقول لك how you are going to reduce a fracture تقول لي we have 3 steps in treating a fracture. First of all reduce, second hold, and third exercise. Reduction, immobilization, and exercise. يمكن أقول لك what are the types of مثلا immobilization تقول لي cast, POP cast تقول لي internal fixation, external fixator. يعني هذه الأشياء اللي أنا أسألك بها بس إيش كم يوم وإيش كم أسبوع وشنو التفاصيل لا هي ما مطلوبة منك وذني الصور أنت بس حتى تشوفها وتبقى في مخيلتك. أنتم بصف رابع راح تأخذون شيء اسمه orthopedic block هذا بكل التفاصيل مع الأورثوبيديك and fractures. أوكي ذاك الوقت أنتم يعني تنسألون عن التفاصيل. أنتم بالنسبة لكم العموميات هي المطلوبة. أوكي
شكرا
دكتور.
نعم
شنو سبب ارتفاع هذا البروكسيمال part of clavicle؟
proximal part of the clavicle there is a muscle اسمها cleidomastoid muscle مو أخذتوها أنتم بالاناتومي. cleidomastoid muscle inserted to the proximal part of the clavicle. فمن يصير fracture هاي المصل راح تسحب لك الكلافيكل upward راح يصير بيه upward displacement. هسه افتهمنا ليش يصير بيه upward displacement by the action of the cleidomastoid muscle.
تمام شكرا جزيلا دكتور.
ممنون. بعد منو عنده سؤال أو أي تعليق آخر شباب؟ أوكي أدزلكم إياها على محمد صلاح بالتليجرام.
الاختصارات ممكن نجاوبها الامتحان أو نجاوب بالاختصارات مثل ما هو موجود.
والله كون أنت فاهمها أنا أخاف أسألك في الامتحان الشفهي يقول لك شنو هذا الاختصار وأنت ما تعرفه. يعني شنو مثلا الحقيقة أنا أكره الاختصارات بس في يعني أكو اختصارات هي متفق عليها مثل ما يقولون. هسه أنتم عرفتوهن ذني الاختصارات كتبتوهن إن شاء الله؟
يعني جزء منها هي حتى لو فهمت يعني الاختصار الوقت
يعني ORIF يعني شنو مثلا هواي حكينا عن ORIF Open Reduction Internal Fixation.
زين دكتور إذا تقدر دكتور المحاضرة اللي ندزها حتى لو بس أول سلايد تكتب بيها الاختصارات إذا تقدر دكتور.
ما لحقتوا؟ ما لحقتوا
مو كلهم. أنا مو كلهم دكتور، بس دكتور إذا تقدر يعني عندك وقت حتى لو بس أول سلايد المحاضرة تكتب بيها الاختصارات.
أسوي لكم إياها سلايد وأدزها؟ أوكي.
إي والله دكتور إذا تقدر.
مو مشكلة، احتمال أدزكم إياها سلايد هيك منفصل، خلي أدزكم المحاضرة أول شيء ونشوف. أوكي.
إي دكتور يا ريت ممكن يصير تعبنا.
ما يخالف، أسوي لكم إياها سلايد واحد ويندز أو وراها هاي ثانك يو ميرسي، ما يخالف. أوكي ماشي. بعد أي واحد عنده سؤال استفسار شباب؟ الأسبوع اللي همينا بنفس الموعد عندنا المحاضرة الأخرى بإذن الله إن شاء الله.
دكتور.
نعم.
عندنا اثنين مصطلحات اللي هي ديسبليسد وانديسبليسد، شنو الفرق بينهم؟
دكتور احنا عندنا فراكتشر يعني كسر، ديسبليسد يعني صاير بي ديسبليسمنت يعني متباعد الأجزاء الفراكتشر. انديسبليسد يعني ما هو صاير كسر بس ثابت بمكانه. يعني انت مرات تباوع كسر البلبون بس الكسر ما متحركه اجزاء، مكسور والعظم في مكانه، يصير له ما يصير. ديسبليسد يعني معناها تحركت الاجزاء عن مكانها. مفهوم عيني؟ انديسبليس اكو فراكتشر ما متحرك، هذا ما يراد ريدكشن. الديسبليسد يعني صاير متحركه الاجزاء فممكن يحتاج ل ريدكشن يعني حتى ترجعه الى وضعه الطبيعي. اوكي حبيبي.
شكرا دكتور.
نعم ممنون.
العفو دكتور، بلا زحمة عليكم، إذا ممكن ترسلون محاضرة الأسبوع المقبل لأنه الدكتور ما موجود على الموضوع. إذا موجود دكتور ما أدري بحثنا عنها ما لقيناها.
أجزيكم إياها على التليجرام ما يخالف أحسن.
إيه دكتور هو على هذا الجروب.
ومال الإيجنج معكم الإيجنج الأخيرة مالتي إيجنج همينة.
دكتور أتوقع موجودة الإيجنج.
راح أجزيكم إياها هذه وذيك والأخرى ثلاثة راح أجزيهم.
تمام دكتور عشرتكم.
أخاف بهن شوية إضافات أو شيء. حاضر.
تمام دكتور.
بعد منو عيني عنده سؤال؟ أوكي شباب، إذا ماكو سؤال شكرا لكم عيني، راح أجزي لكم إياها هسه.
تمام دكتور.
على محمد يلا صار يلا في مع الله مع السلامة.
شكرا جزيلا. أهلا وسهلا دكتور.
شكرا لكم عيني.